Okay. Nikunj, we also have Dr. Pratit Samdani joining us this morning and from Breach Candy, and he's Breach Candy Bhatia Saifi Jaslok Hospitals. He's an internal physician and intensivist, and with all the news around the vaccine, it'd be interesting to get a view from him. Dr. Samdani, thanks for joining us. We're all, listening very closely and waiting to see how this rollout's going to happen. From what we can understand, India has also been buying big doses. We've got Pfizer and Serum applying for emergency use now. What does that mean? How soon do you think, assuming they were to get that nod, could we actually see the vaccine being rolled out?
Thank you very much. Yes, so there is some good news. At least the thing that we will all be waiting for, the vaccination or the vaccines are going to be available soon in India. I think the Prime Minister has already announced that there will be a couple of weeks where they would start rolling out the vaccine. We now know that Pfizer and the Serum Institute, along with Oxford, has already applied for emergency use. The Serum Institute, the Covishield vaccine, both of which are mRNA vaccines, have actually gone to the Central Drug Laboratory for testing. They've sent about 12 batches. The moment they get their approval or clearance, they've also applied to the Drug Controller of India. And the moment they get the results, I think the vaccine should be out. So my guess would be anywhere from 2 to 3 weeks. Normally, it takes about 3 months for the entire processes to come in place and permissions to be granted. But this is an emergency use situation. So I think within the next 2 to 3 weeks, we would be able to get some vaccines in the country.
Dr. Samdani, good morning. Nikunj Dalmia also joining in. So I'm going to ask you a direct question, Dr. Samdani. After this interaction, if you get a SMS from an old patient of yours, and if his question is, Dr. Samdani, when do you think I should get a shot in my arm? How safe it is? Because right now, the vaccine is on fast track, which means a lot of corners which normally were considered, they may have been avoided. How safe do you think it will be for us to get vaccinated in this entire mad rush?
Good morning, Nikunj. That's a strong question. And I think as per the schedule and, the government regulations, it's going to be the healthcare workers and the doctors, associates of the hospitals and clinics who will get it first. Now, how soon is a great question. These are vaccines or trials that have been done very, very quickly to get emergency approval. We do not know the long-term effects of these drugs. So we do not know the immunogenicity property. That means how much side effects can they have. Primarily, you get an approval for a drug or a vaccine based on its efficacy and based on no side effects. So they have both cleared it. But we also don't know what is the genetic sequence that's going to change in future. So I would say it's good to get the vaccine early, but a good time frame would be waiting for about 3 months so that we really study and know the effects of it.
Dr. Samdani, while it will be a very tall order to get the entire country vaccinated, at what point do you think that the critical point that so many vaccines have been administered and the corona spread will start reducing? It is important for us to focus on the spread rather than the actual vaccination. Where is that sweet spot according to you?
Yes, so we are seeing a good decline now across the country of the actual active COVID cases. And I think the rule is to protect the ones who fight for you in the front. So protect the ones behind who are right in the front. So if you start protecting the healthcare workers and the ancillary staff of the hospitals and clinics, you will be able to mitigate or decrease the rate of infection or spread of infection. However, you need to populate about 60 to 70% as a ballpark figure, just a rough figure, to prevent an actual spread of COVID infection. Understanding well that the efficacy is good, close to, as the studies say, 90-95%.
Closing comments, Dr. Samdani. The vaccine is on its way, but till the time vaccine is not out, do you think one should not drop the card? We all have experiences where our families have suffered, and it's a pitch perhaps I would urge you to make that till the time the vaccine is not administered, one should wear mask, wash hands, and not drop the guard.
So it's very, very important that not only till the time the vaccine is not available, even thereafter, the vaccines aren't going to have 100% efficacy. for self-protection and for protection of the community. It's imperative, and I would say almost as important as you wear your own clothes, to wear a mask when you go out. Try to keep some physical distancing, maintain hygiene, clean your hands regularly, wash your hands regularly with soap and water for at least 20 seconds or with an alcohol-based scrub so that you prevent the spread of this infection. So even if the vaccine comes, until we really don't see a complete fall-off of the virus, I think you still must wear that mask when you go out or when you interact with people. I know it's been a bad suffering for many of us. We've had folks, families, friends succumb to this illness. Even if they've not succumbed, they're suffering because of the aftermath of this acute viral infection. So let's prevent this. Let's all pledge together to wear our masks at least when we go out.
Absolutely. That's the least that we can do. Dr. Samdani, great to have you on the show. It always is. Glad that you could take time out and speak with us today.